Hi, thank you for joining me on Walk the Walk, but first let's talk. I'm Dr. Beth Wilson, and today I wanted to do an informative video to educate you all on one of the leading diagnosed mental illnesses in America, and that is anxiety. Over 18% of adults and over 7% of children struggle and suffer from the different symptoms that are experienced with anxiety. So I just wanted to inform you all of what the different criteria are and those symptoms, what they might look like, but with everyone to keep in mind that the symptoms will be different in everybody who may suffer from this disorder. The first criteria is excessive worry more days than not. So this looks like you struggling to get something out of your mind and you really worrying about something that's completely out of your control. The next is difficulty to control that worry. So when you may even be on the phone at work and you have a thought in your mind that you can't get out of, and when you hang up the phone, you have no idea what was just said to you. So you are really struggling to get those thoughts out of your mind. The next section is 3 or more of 6 different criteria, and you have to meet at least 3 of those. So we have restless or on edge, so difficulty getting comfortable. You feel that you just can't stop moving. You always have to be doing something and be active. Easily fatigued, so you get tired very easily. You have the need to take a nap a lot of the time. Difficulty concentrating. This could be whether it's at school, at work, or even just in a simple conversation that you may have with someone day to day. Irritability, so you get very easily agitated, easily annoyed with other people, and you struggle to manage that. Muscle tension, so tense muscles, always on edge, just not being able to relax and let go of something. Sleep disturbance, difficulty falling asleep, waking up in the middle of the night and not being able to go back to sleep. And with all of these, meeting 3 or more, always keep in mind that these symptoms have to be present for over 6 months. So when looking at anxiety, it can't be a situation that's taking place that leads to this worry. For instance, you're getting ready to take the SAT test and you've registered and you're, oh, I'm so nervous, I can't do this. I'm not even going to study because I know I'm not going to pass. That worry and nervousness that you feel is most likely normal for that situation when it comes to taking an SAT test. But when you have worry that's lasted for over 6 months for something that most likely won't happen, it could be the fear of you losing someone you love. Even if it's, oh, I think my mom's just going to move out of the house. There's nothing happening for that to even be a thought in your mind, but it's a fear of being alone or abandonment, and it's something that you just can't control. So these symptoms have to cause some type of clinical distress. So when we look at that, it could be in different environments. So in the school environment, you just can't focus, you can't do your work, you may get stomach aches or headaches. At home, you may not get along with the people that are in your home, or you may isolate and go to your room because of the fatigue or distress that you may feel. At work, you may have difficulty talking to other people that are on your team, or you may struggle to just really engage with other people and be able to focus on the conversations at hand. And also just in social environments with friends, peers, people that might come over, going to church, things like that. These symptoms will cause distress in those different environments, or at least one of those environments. So, and the last thing is that these symptoms cannot be attributable to physiological effects of a substance. And by substance, we are referring to a prescription that you may have from your doctor. It may be a prescription that's to help one medical condition you have, but it causes anxious symptoms. Or the other substances, of course, illegal drugs, and sometimes those can cause some anxious symptoms. So when it comes to anxiety, the most widely used intervention or therapy is cognitive behavioral therapy, known as CBT. A lot of people have probably heard of it. And with cognitive behavioral therapy, the goal is to be able to help an individual with changing their thoughts. We use the cognitive triangle, that's why I was doing this, to change your thoughts, because your thoughts impact how you feel and your feelings control how you behave. So when we have, bringing up the SAT example, a negative thought of, oh my gosh, I'm just not going to be able to do this, I might as well not study. your negative thought leads to the feeling of anxiety or hopelessness, and that feeling will lead to the behavior of, I'm just not going to study. So we want to change that initial automatic thought to something that's more positive, to it's okay, I'm just going to do my best. And if I don't pass, I will just do it again. So we want to change someone's cognitions to be an automatic positive thinking in order to cause a positive feeling or a comfortable emotion to go along with that. That will then lead to a positive behavior or reaction to that feeling. So also, along with therapy, pharmacology, medication is also used in treating anxiety. And there's different types of medications, and I'm not the MD, so I don't prescribe, but that is also something that definitely helps people to stabilize and get in a stable place, to help them be able to learn the different coping strategies and mechanisms that will be taught to you so that you can learn to better walk the walk. And then you could also help people by talking to them and encouraging them to seek professional help as well. So I hope this video was informative. I hope you learned something. Please do not hesitate to ask questions, post comments, send me an email at bwilson@ithrive.net, and don't forget to subscribe to our page and like it. Thank you for joining me once again on Walk the Walk, but first let's talk.